You know, one of the challenges is how do you measure how well your front office team is doing? And I think it's really cool through the dental intel follow-ups that you're able to see how many of those calls, or how many patients are we calling to get back on the schedule, the recare, the unscheduled treatment plans, so you can actually see how many calls each individual person made and how much money that was added to your schedule. Actually, last year alone, from those phone calls, we added $500,000 to the schedule. Crazy. Yeah. Yeah.
That's game changing.
Right, and we were able to acknowledge the people that did the work. So we were able to say, hey, so-and-so, you made 200 phone calls and that equaled $50,000 worth of extra work. So, kudos. My name is Erika. I'm the practice optimizer for Spodak Dental in Delray Beach, Florida. We've been using Dental Intel for a couple years now, and my favorite part about Dental Intel is how easy it is to use. You don't have to think about it, it's almost dummy-proof, and it makes my life a lot easier. Since we started with Dental Intel a couple years ago, we didn't really know how we were actually doing. So we had some hunches. We thought we were doing really great with how we were reappointing patients. And then we had some hunches that we weren't doing so great as far as treatment acceptance and presentation. And when we turned Dental Intel on, we had a pleasant shock of reality. And one of the things that improved the most was that a reappointment rate. It also allowed us to focus on specific goals and measure how they changed over time. So we weren't guessing anymore. We actually knew if we were making progress or if we were regressing. I love the Dental Intel app. So cool, just to be able to log in and now you have the stats right at your fingertip, which is great. So we use that as a part of our review process. We use that as a part of our progress. How well are we doing? Here's our goals. Are we going to meet those goals? It has patient phone numbers and information on there, so you can literally look up the patient that you had for that day, click on their phone number, and go ahead and reach out and find out how they were doing after that procedure. And that was really valuable.